Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Drugs in general anesthesia, and we'll be focusing only on the inhalational here. So inhalational, it can be by gas. Gas, it is N2O, or it may be xenon as well, or the cyclopropane. Looking at volatile liquids, it may be ether, halothane. There is desflurane, isoflurane, sevoflurane. Now, next looking at nitrous oxide. Let's look at each of them individually. Nitrous oxide, what is the advantage? The advantage of nitrous oxide is that it is an analgesic, it is non-toxic, and also it has something known as a second gas effect. Then moving on to the disadvantages. The disadvantages is it is a poor anesthesia, it has diffusion hypoxia. It can decrease also the B12 levels, and it is avoided in air-filled spaces surgery. Should be avoided, the air-filled space surgery. Next, moving on to halothane. Halothane, the advantage is that it is a patent anesthetic. Next is it is also act as a bronchodilator. It is used in case of asthma, bronchial asthma, controls the hypertension, as well as uterine relaxant, as well as used in children. The disadvantage of this halothane is that it is a poor analgesic, and there is a CVS suppressant. Contraindication is in case of the pheochromocytoma and also the malignant hypothermia. Also, it can lead to the hepatotoxicity. H for H, that is halothane for hepatotoxicity, as well as hypothermia, that is malignant hypothermia. Next, moving on to ether. Ether, it has a pungent odor. So ether, it has a pungent odor. It acts as a good analgesic. And next you have N-fluoride. N-fluoride, it causes seizures. Now moving on to isoflurane. Isoflurane, it contains a pungent smell, pungent odor or smell. It maintains the CVS stability. So all this is isoflurane. So isoflurane, it maintains CVS stability, pungent odor. It is preferred in case of the cardiac patients, all the IST. Then moving on to the desflurane. Desflurane, it is used in case of the daycare surgery because of the fast induction and recovery. This happens in desflurane. Next is the sevoflurane. The sevoflurane is used in induction as well as the maintenance, and it is preferred in terms of children, and it is not used in closed system, that is related to nephrotoxicity. Lastly, we move on to xenon. Xenon is very expensive. It is mechanism of action being the NMDA antagonist, and there is a TREK channel agonist. It has a fastest induction and fast recovery. Also, all are non-inflammable, and it is non-explosive except ether. It is non-explosive except the ether. Then all produce the hypertension. So xenon, it produces hypertension, and all produce respiratory depression as well. Respiratory depression, and also the muscle relaxation except the nitrous oxide and the halothane. So most of them, they are nothing but they are the bronchodilators, and all can cause malignant hypothermia except that of the nitrous oxide. To learn and grow daily like this, please do subscribe.